So I'm going to start by discussing the history of breast sonography or ultrasound. The two words are interchangeable. So Lazarro Spallanzani, an Italian biologist, is credited with discovering ultrasound. In 1794, many years ago, he did studies on bats, and I won't go into the specifics because they're pretty horrific studies, but he did studies on bats showing that they determine their location and travel using sound instead of sight. And these sound waves reflecting or bouncing off of objects to determine the location of an object is called echolocation. And this is the idea behind medical ultrasound. That's really the entire basis of it all. And so sound waves at a higher frequency than that's detectable to the human ear are the hallmark of ultrasonography. And there's no radiation used in ultrasound exams. However, initially ultrasound was actually used in military maneuvers and through the world wars. And it was released for general use only after World War II. So from 1794 until just after World War II, really it wasn't used for medical ultrasound. And so in 1941, towards the end of World War II, an Austrian neurologist, Dr. Karl Theo Dussek, not to be confused with his father, another Dr. Karl Dussek. Dr. Karl Theo Dussek wrote a paper called On the Possibility of Using Ultrasound Waves as a Diagnostic Aid. And in 1942, he first used ultrasound to help in medical diagnosis. So with the help of his younger brother in 1947, he published the first ultrasound images of the human brain and ventricles. And these images really showed that ultrasound could potentially be used in detecting tumors in live patients in a non-invasive manner. So that was really exciting, that we didn't need to use invasive technology to be able to view the insides of human beings. And it was in 1951 that the first 2 breast tumors were interrogated by ultrasound in a living patient by Drs. Wild and Neal. One of those masses was benign and the other was malignant. And in 1952, about a year later, Drs. Wild and Reed published a paper reviewing the ultrasound findings of 21 breast tumors. 9 of them were benign and 12 malignant. And they reported the clinical application of breast ultrasound in 1954, not considering that this modality could actually be used for screening. But once they got started, they realized that their evaluation of breast tumors was remarkably accurate. And in fact, of the 12 tumors that they believed had a malignant appearance, all 12 were found to be malignant, so they actually did surgery, removed them, and reviewed them, and they were in fact found to be malignant. And then of the 9 tumors with a benign appearance, those also were removed surgically, and all 9 were in fact found to be benign. So with these exciting results that we could actually differentiate by ultrasound between benign and malignant tumors, efforts were made to really improve sonography equipment. And in the 1960s, efforts in improvement of breast ultrasound were centered in Australia, Japan, and the United States. And in the 70s, breast ultrasound really saw regular clinical application. The grayscale and transducers that we used were being improved, and in the 1980s, digital imaging became available, just like digital imaging and mammography. And that truly helped in the resolution of breast images and in identifying not only breast tumors, but breast anatomy by ultrasound. So advancements in refining the images that were seen on ultrasound continued through the early 2000s, so not that long ago. And in fact, today there's continued development of ultrasound machines and transducers. And it's really exciting that we continue to get better and better imaging and better deduction between the anatomy of the breast. So ultrasound can be done either handheld or automated. And handheld, if you've ever had a fetal ultrasound, if you've been pregnant and had an ultrasound of your uterus in the gynecologist office, that's exactly a handheld ultrasound. So exactly the same thing can be done on the breast. And the thing with the breast, though, is that handheld ultrasound, and probably with gynecologic ultrasound too, but we're talking about breast here, but handheld ultrasound requires significant skill, experience, and patience. And whereas automated or semi-automated whole breast ultrasound is continually being improved. And although this, specifically automated or semi-automated ultrasound, is a more reliable screening tool because a motorized arm scans the breast to produce hundreds of overlapping images, it's still not really available everywhere, and those images still have to be reviewed by a radiologist. And if an abnormality is found, the patient is then called back for a targeted ultrasound that is handheld of the spot in question to determine the next steps in the patient's care. So that's the history of ultrasound and the types of ultrasound